Hi, Medpi. How are you?
I'm okay. How are you, Dr. K?
I'm very good. I hear you're having some foot pain.
I am.
Okay, could you tell me more about that?
It's dull and achy, and it's right in the middle of my arch.
Okay, so on the bottom of the feet. When did you notice this?
About a week ago,
Okay.
I was running, and I think it was not an even surface.
Okay.
It recently snowed that day, and because of that, I didn't see how the ground was, and I kind of flipped my foot on the side, and that's when I started to first feel the pain.
Okay, so you flipped your foot. Were you on like a sidewalk curb, and it was like the curb of the sidewalk, or was it just a random movement?
It was in the woods, actually.
Oh, okay.
On the trail.
Okay. Yeah, that can present all kinds of surprises. So is there a time of day it hurts more than others?
More in the morning.
Okay, and then does it ever not hurt? Is it consistent throughout the day?
It doesn't hurt if I don't put pressure on the foot.
Okay, okay. I want to ask about your shoes. How are they fitting you?
They're a little bit tight, to be honest.
Okay. That definitely can exacerbate the pain. Like you probably sprung something, and I'm going to take a closer look to see if it's something that requires further medical care or if it's just something you need to rest on. But wearing shoes that are too small can definitely irritate any pre-existing pain.
Honestly, I don't think they're too small. I think now they're just tighter because the foot is more swollen.
Because the swelling? Okay.
Yeah.
What size shoe do you wear?
8. And I've been wearing that for the last 10 years at least.
Okay. Are the shoes relatively new?
No.
Okay. All right. And so right now on a scale of 1 to 10, how would you rate your pain?
Right now I'm having no pain.
Okay.
Only when I put pressure on it, I would say it's about a 3 or a 4.
So pressure meaning whenever you walk, like every step you can kind of feel it?
Yeah.
Okay. Did you stop running after you had that incident, or did you keep going?
I stopped running.
Okay, good. So you haven't been running for about a week?
Yeah.
Any skin issues or itchiness?
No.
Anything you notice visibly besides the swelling? Would you say it throbs?
It's dull
more
and
of a
achy.
dull. Okay. Okay. So I'm going to start with a vitals check, and then I'm going to proceed to doing an inspection of the feet. I will look at your skin. I'm going to examine the muscles and see if I can apply some treatment to alleviate the pain. I'll also be doing some reflexology treatment to help stimulate organs of the body corresponding to different sections of the feet, which I think is a very effective practice, although it's new. Okay? Any questions?
No.
All right, I'll begin. Okay, I'm going to take your blood pressure and oxygenation.
Okay.
Go ahead and uncross your feet for me. Give me your index finger here. Can I go ahead and have this arm? Okay. It's 105/90. I can go ahead and slide this off. Okay, I'll take this as well. Okay, that's normal. Always taking your temperature. Any flu-like symptoms in the past few weeks?
No.
Okay. Go ahead and hold this. Thank you. Okay, I can take that from you. 98.3. Perfect. Okay. Just going to take a look at your ears and your eyes just to make sure that you're all healthy and there's no issues here. Just because it's been a while since your last exam. Okay, healthy tympanic membrane. It's a nice pearl gray. Okay. Look here. Okay. You have a bit of wax buildup. Something to take care of on your own time, but it doesn't look to be too obtrusive. No irritation here. Okay. She looks straight ahead at me, just looking for pupil dilation. Good. Any vision problems?
No.
You seeing okay? All right. Right. So on your feet, I'm going to be doing some neurological tests just to see if you're having numbness along with the throbbing and aching that you described. But I want to get a baseline of just how your face perceives sharp and dull so I know what's normal and what's not, okay? So this is going to be a dull sensation. Do you feel that?
Yes.
Okay, and this is sharp. Do you feel the difference?
Yes.
Okay, so go ahead and say sharp or dull depending on which sensation you feel.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. 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 Dull. Sharp. Dull. 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 Sharp. Sharp. Dull.
Okay. Those are normal responses. All right. So I'm going to have you get up on your feet and we're going to do a gait assessment. I'm just going to look at the way you hold your feet when you're walking and standing, okay?
Yes.
Okay, could you go ahead and take a few steps toward me? Okay, stop. All right. And you have a belt level of 3 or 4 pain when
Yeah.
you just make those simple steps. Okay, could you turn around? Just want to see your gait. Okay, it seems pretty even and symmetric. Why don't you come here and just face me? And can you hold your foot with the opposite hand in the stretch? Okay. Oh, does that hurt?
Yeah, it did.
Okay. Okay, go ahead and rest it. Don't do it if it hurts too much.
Okay.
Okay, can you do the opposite foot, or is it just... Still pain there?
No, I'm not having as much pain.
I'm just trying to assess your kneecap strain and how your heel is sitting with that. Okay, and when I press here, do you feel the pain?
Yes.
Okay, go ahead and relax. All right, I'm going to go ahead and palpate your knees and making sure that that's okay.
Okay.
All right, if you could do like a lunge movement, so like if you could step back with this foot and then slightly bend this one. Okay, good. Okay. I don't see any soreness here. I'm just trying to rule out any issues with the kneecaps or the knees. Let me know if you feel any pain, okay? Okay. Okay. And I'm going to bring my thumb down from your kneecap to your shin.
Okay.
All the way down to your ankle. Let me know if you feel pain along this muscle, okay?
Okay. No.
Okay.
A little bit there.
A little bit here. Okay, a little on the ankle.
Yes.
Okay. I feel a little bit of tension, but it's probably just trying to compensate. Are you limping at all?
You can barely tell, honestly.
Okay. All right, but that's something that might progress. Okay. So, go ahead and switch feet. I just want to see the other ankle. Okay. Okay. Any pain?
A little bit.
A little bit. Okay. I'm going to do the same thing, bringing my finger down to your ankle. Let me know if you feel any sharp pain.
Okay. No.
Okay. I'm just going to be measuring for symmetry here and make sure that there's no edema that I'm missing, but your knee looks to be unaffected. Let me go ahead and see the other knee. Thank you. It's about 9. Okay, so you have a symmetric calf. Symmetric thoracic calf. Okay. I'm going to go ahead and just palpate your ankles as you stand, okay? Pain here?
A little bit.
Okay.
Right there.
Right here?
Yes.
Okay. All right, that goes along the arch of the foot, like you said. So this is where
And
the main.
also in the middle.
Yes, right here.
Yeah.
Yep. Okay. Definitely seeing some swelling here. There's a whole muscle mass protrusion, so it's a good thing you stopped running. Can I see the other foot? Same thing here, but not as much. So I'd say your right foot is definitely more affected. Okay. Okay. Let me see this again. I'm just going to palpate here. All right, I'm going to have you go ahead and lay on the bed, and I'm going to do some further measurements.
Okay.
So I'm just going to start with an initial inspection of the skin. I'm checking for any redness or bumps or any issues stemming from your muscle strain that may have affected the skin. So you do have some cracking at the heel. Okay. I don't see any dryness. Okay, some blistering. So I do see a blister in between these two toes. It's white, which means it's mostly healed, but it could be a sign that your shoe size is wrong. Just looking here. Okay. Otherwise, the skin looks healthy again. See, I see a blister in between these two. This one is scabbing over a little bit, so I'd be very careful when I apply the topical ointment. You have blistering in between the toes. Okay. You have pretty moist follicles. No dryness here. Just on the heels. Okay. Some major swelling on the right foot. Right here. Just gonna look at the skin, see if it's impacted. Okay. Definitely swelling. Okay. Okay. I'll be taking some measurements. Before I do so, I'm going to look at your pedal pulses. 2+. Okay. And your capillary refill, I'm going to look at that for circulation. Okay. Okay, that's a 3-4 second refill, so your circulation is not the best, which could really impede the healing process. It's 4 seconds. Okay. And it probably has to do with the cold weather and the fact that you have not been exercising, because physical activity tends to stimulate circulation. So your blood flow isn't optimal. Any pain when I press on the toes?
No.
Okay. All right. I'm just going to do some measurements of different parts of the feet, so just continue to relax, okay?
Yeah.
This is 7 centimeters. 6 millimeters. Okay. So that's the metric of the toes. Okay. Okay, that's 12.5. That's 12 3/4, so it's a little bit off. 12.5 3/4, okay. Good measuring. That's 15. That's 2 inches. That's 5.5 inches. It's only 4 3/4. So the right foot is very swollen. Okay. This is 5.5, so the pads are symmetric at the top. Okay. 13 centimeters, and then we'll core the inches here. It's 5.5. Okay. There's one discrepancies in the midsection of the bottom. Okay. Okay. All right. This is 27. Okay. 27 quarters. Okay, so the length is normal. Okay, I'll be just measuring the heels, so just lifting your leg slightly here. Okay. That's exactly, that is 10.5 inches. Okay. All right. Okay. And then this one is going to be, okay, so your ankles aren't as swollen. Just the biggest swelling is happening right in the arches of the feet. All right, I'm just going to be palpating a little bit more. And let me know if you feel any pain. Okay. Right there is pain, yeah. Okay. Okay, it's just the stress, massive muscle. So I'm going to be applying pressure point therapy to aid with that. Okay. A little less pain on this one. I'm just going to be doing some foot myotomes, okay? So just a strengthening test. I'd like you to go ahead and, if you can, straighten your feet. Great. And I want you to push against my hands with just the pads of your feet up here, okay? All right, 3, 2, 1. Okay, very good. Now try to bring your shins, Now try to bring your feet up towards yourself. Good. Okay, very good. Now try to move your feet outwards like this, okay? 3, 2, 1. Okay, good. Now try to bring them inward in 3, 2, 1. Any difficulty doing that?
A little bit.
It's painful. Okay. All right. Now try to lift your feet in the air. I'm going to try to prevent you from doing that. 3, 2, 1. Lift your ankles. Up, up, up. Okay. Do both at the same time. Can you do both at the same time?
No.
No? Okay. Okay. Go ahead and try to lower your foot to the ground. Okay, that's very good. We're going to do the opposite side. Okay. All right, very good. I'm going to have you flip around just on your stomach so I can assess your knee mobility. Okay. So I'm just going to do some slight knee rotations. Okay, so just give me all your weight. I'm just going to be rotating your knee. Let me know if you feel any sharp pains. Okay. Any pain there?
No.
Okay. Okay. All right, and just to judge your strength, try to push against my hand right here with this foot, okay? So try to bring your ankle to the ground, to the foot of the bed, okay? 3, 2, 1. Okay, Good. Now the opposite way, so try to bring it towards yourself. 3, 2, 1. Okay, good. Now try to go against my push here. So turn your foot inward in 3, 2, 1. Great. And then outward. 3, 2, 1. Okay, normal strength there. I'm just going to be palpating the back of the knee since I didn't get that earlier. No abnormal protrusion, so that's good. Okay. I'm going to be rotating this knee. Any pain?
Yes.
Okay. Does it stem from the knee?
I think it comes from the foot.
Okay, so it comes from the foot whenever I rotate your knee?
Mm-hmm.
Okay, that's good to know. And that's on the right foot, which is definitely more affected. All right, so just gently we're going to do the same exercises, okay? So try to bring your leg towards the bed in 3, 2, 1. Good. Now try to bring it towards yourself in 3, 2, 1. Excellent. Now try to resist my push and bring it inward. 3, 2, 1. And outward. 3, 2, 1. All right. All right. Next I'm going to try to be cracking your toes. I'm just going to be loosening up the joints here just to get blood flow simulated before I apply treatment and pressure point therapy. So this should feel relaxing. The toes might not crack, that's fine too. I'm just trying to loosen up your joints. Okay. Good. Great. Excellent. I'm going to try to use this here. Okay. Okay. Let's do the opposite. Just relax your foot. Okay. Okay. All right. So this is going to help stimulate blood flow, provide some moisture. And this ointment has anti-inflammatory properties, which is going to help soothe the swelling. Okay. Okay. Apply some massaging techniques. Stir up in the oil. That should feel like a cool sensation. Okay. Okay. And just a third massage technique here. Ankles as well. Okay. Okay. So I'm going to blot this with a tissue. That should have soaked in quite well. Okay. All right. I'm going to be doing some reflexology techniques just to help the organs and the rest of your body free up blood flow to stimulate the healing process. Okay, so the arch of the feet is where I'm going to start. That's where your pain mostly is, and the arch of the feet correlates to the thoracic spine. So if you've been noticing issues with the thoracic spine, just along your lower neck alignment, it definitely is comorbidity with issues with the arch of the feet. So just relax. It's going to feel a little bit painful. I'm going to apply a lighter pressure here. Okay. Okay, and the large toe correlates to the pineal gland, so I'm just going to apply some pressure there. And the small intestine is related directly to the center of the feet. So very lightly I'm going to massage that center. Okay. Remember to breathe. Take deep breaths. Good. And the sciatic nerve, release to the heel. Okay. Your diaphragm and breathing tie into the outer edges of the feet. I'm going to apply pressure a little bit harder because this area is a bit less sensitive, and it's going to help you with your breathing as you pick up exercise again. Great. Okay. And last but not least, the ascending and descending colon correlate to the very base of the toe. So I'll be hitting each one with a medium pressure. Sorry. Okay, so that was the reflexology treatment. I'm going to perform a couple of simple neurological tests just to make sure you're not experiencing numbness. So this is going to be a dull sensation. Do you feel that?
No.
No? Okay.
Yes.
Okay, very good. This will feel sharp. Do you feel that?
Yes.
Okay, go ahead and say sharp or dull, depending on which one you feel.
Sharp. Dull. Sharp. 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 Dull. Dull. Sharp. Dull. 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 Sharp. 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 Dull. 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 Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Dull.
Okay. Right. I'm going to just rub in to make sure your feet topically respond. Okay. We're going to do one more test. This is going to be a warm or cold test. So do you feel this as a cold sensation?
Yes.
Okay, great. Then this will be warm. So just say warm or cold.
Okay. Warm. Cold. Cold. Warm. Cold. 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 Warm. Cold. Cold. Warm. Cold. 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 Warm. 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 Cold.
Okay, Med P. Those responses came back normal. I'm going to have you sit up now and we're going to discuss the results and the next steps you should take, okay?
Okay.
Okay, Med P. So I did some massage treatment. I applied some oil, which I'm going to send some home with you. I was able to kind of like dig deep and really palpate the area that's affected, and you do have just very severe swelling. So I would just take a while to drink a lot of water, get a lot of rest. Avoid any strenuous activity, rest as much as possible, and also give your feet time to circulate. So in between periods of rest, so say like you're sitting or you're laying down for 20 minutes, whenever you can. I know you have a busy schedule. Try to do some very light movements, just lifting and lowering the knee to make sure you're getting the circulation, because your circulation was quite poor. Are you taking anything over the counter for this?
No.
Okay, all right. I would suggest some Motrin or ibuprofen, to be honest, and I can write you a prescription for extra strength.
Yes.
600 milligrams to take as needed. And I'd like to see you again in a week to go ahead and assess if the swelling has gone down, okay? All right. So,
Sounds good.
other than that, do you have any questions?
No.
Well, thank you for allowing me to do this exam, and I hope you feel better soon, okay?
Thank you.
All right.